It's a silent killer. Nothing will come up before actually the cancer has grown inside and has become incurable. So the message here is, don't expect cancer to declare itself. Definitely not the prostate cancer. You should go out and look for it. You should understand the risk. And if you find it early enough, it's very curable. But if you wait for the signs and symptoms to come and the cancer declares itself, the battle is usually a difficult battle. It's a silent killer. Don't wait for the symptoms. Yeah, symptoms can happen. When it's quite advanced, people may have difficulty in passing urine, people may have some pain, people may have some blood, but that usually is a sign that the cancer is growing into the surrounding area, is blocking it. But the similar symptoms can actually happen because prostate doesn't have just the cancer. Prostate can have benign prostatic enlargement, and that enlargement can produce the symptoms, and it's very confusing. So my message, go and look for prostate cancer if they have a high risk. And that's what saves life. Testing for prostate cancer is a male issue. They normally should start having a conversation with a doctor, a PCP, a primary care, an internist, a urologist, when they are about 45 to 50 years of age. And when we talk about the testing, it's not just about testing, it's all about testing and what are the implications of the testing, what we call shared decision making. What on an average, if I have to give one word answer, any man who has a life expectancy more than 10 years of age, is above 50 and is below 69 or 69, they should be having a discussion with their doctors about PSA screening or prostate cancer screening. We can have this conversation earlier if someone has a family history of prostate cancer, someone who is a BRCA positive, someone who is of African American race, because in that group, we could consider them as to be a high risk of prostate cancer, and that discussion can start at about 40. So it's all about the individual's risk for prostate cancer. Simple number, 50 to 69. More detailed number, starting at 40 if they have a high risk of prostate cancer. Prostate cancer can be checked, and that's the beauty of it. About 288,000 men were diagnosed with prostate cancer last year. About 34,700 men died due to prostate cancer last year. And majority of these deaths were avoidable if you would have found the cancer a little early. So how do we find prostate cancer? How do we go about screening it? It's a simple test known as a prostate specific antigen. I simplify it to even more simpler term. PSA is for please stay alert. If men talk about that blood test, I think rest of the discussion goes beyond that. People can have a digital rectal exam. People can have an ultrasound and MRI scans. People can have a more sophisticated kind of in PSAs or the blood testings known as a 4K exosomes in the urine. But discussion starts with the PSA, and people should talk about what this PSA can do for them. The high-risk group can do a lot to, first of all, prevent or be healthy. And it's not a rocket science. It starts with the diet and nutrition, cutting down on carbs, cutting down on processed food, balancing the diet, having more lean protein, avoiding the red meat, cutting down on smoking and alcohol, and exercising a lot. I really mean about 30 minutes a day, 3 to 4 times a week. The guidelines which have already been laid down, all that combined are one of the biggest preventive factors in prostate cancer risk. Obviously, testing it early makes all the difference. This is one of the success stories that if we find the cancer early, we can literally cure in 98-99% of the times. But think about it, in spite of that high cure rate, we still lost 34,700 men last year. Why did that happen? That is happening because we are finding the cancer a little late. 5% of the patients, when we find cancer, they already have a cancer which has gone to the bones, to the lymph nodes, to the other part of the body. We call it as a metastatic cancer. So finding a cancer when it is confined within the prostate makes all the difference. And at that time, It's very curable, and the cure can come many different forms. What we have is a nerve-sparing procedures in which we can remove the prostate using a robot and reconstruct everything back, and patient gets cured of the cancer in majority of the times. We have new kinds of radiations which can do the same job in a select group of patients. Now we are talking about focal therapies in which we can treat a part of the prostate using energy. It could be a heat energy, it could be a laser energy, it could be a freezing energy. And then many of the prostate cancer don't even need an active treatment. They can be monitored, and that monitoring is done what we call an active surveillance. All that combined, we have many forms of the treatment. An expert will tell exactly what is suitable for that person based on person's cancer, stage, grade, and the personal choices. Hope is there, but we need to find it early, then only this discussion starts. I never talked to anyone in the family about the medical issues. That's not a good answer. Basically, if people have many members in the family who had a prostate cancer, people who had ladies having had a breast cancer in the family, or uterine cancer, pancreatic cancer, all that combined can cluster, and that tells us a little bit that there is a family within high risk of prostate cancer. BRCA2 gene, which is a known gene for the breast cancer. BRCA1 is more for the breast, but BRCA gene cluster itself can be a risk factor for men with prostate cancer. Knowing the members in the family going through the same journey should make you a little bit more cautious, and that can save a person's life. I think one thing they should know that cancer will not come and talk to them till it's curable. So go out, understand the risk, and get it tested. That's one thing. That makes all the difference. Downstream, a lot of options come up just because we found it early. And what you can do, prevention is key. Being active, proactive to get the testing, that is a key. And eating right and exercising and not drinking too much of alcohol and avoiding smoking and all those things is an added benefit.